Hello. So this afternoon we're going to talk briefly to capture what you learned about what are points. I'm going to teach you guarding with walking with a patient. We're going to simulate a home health treatment, and then I'm going to show you how to guard if someone loses their balance. So the important thing to do before you get anyone up is you want to review recent medical documentation in the chart. So I am working in a home health setting, so I do have access to nursing notes. I saw that they were out yesterday just to check in with Stephen. He was having a little bit of blood pressure issues, got onto a new medication, and he's doing better. So blood pressure has been stable, which is great. So nursing is going to check in again, it sounds like. And that's always important to check in with your multidisciplinary team. If he was in a hospital, checking chart notes, looking at recent vital sign measurements, or possibly if he had a fall, that could be in notes. And the same with home health nursing notes. If he reported a fall, they would do a screen and document their findings. So you want to assess if the patient is ready to do this. I've called before I arrived just 15 minutes ago. He's ready to go, which is great. He's motivated. I determined he has the strength to do this because of the PT evaluation. He has good upper body strength, and so I have no concerns about him doing this, at least up to this point. So I'm going to get consent. Is it okay if I work with you on learning how to walk with your forearm crutches? Okay, great. I cleared the floor. There's no throw rug in the way. Got that off to the side. The measurements were done with the PT last time when he was laying down. And so that's been good. I'm going to confirm the measurement. He has a gait belt on. He has non-skid footwear. We have the crutches. So we are ready to go. So, Stephen, is it okay if I teach you how to walk today? Okay, great. So we're going to call this a 3-point gait. So let's pretend he's not here right now. So 2 points and 3 points. 2 points, 3 point. Crutches each represent a point. Sometimes these are called 3 plus 1 point because in the traditional, the definition of a point is going through the entire gait cycle. This would be the point, and going through it, it's not being considered a 1 point. But because we're using 2 crutches, it's a 3 point. So, getting back to Stephen. So this is how I want you to walk. Crutches, your affected side, your left side, step 2. Okay? Crutches, affected side, step 2. Okay? Sound good? Okay? So once you square yourself up in the chair, you want to make sure that you're using crutches, that you're not poking on people's feet. That's really important. So I'm going to counter his stronger side. He's used the stronger side, which is right, to stand up, and I'm giving him some stability because he's a little ginger-ish. Let's just say he's a little fearful, would be a more patient-centered word, regarding putting a weight on this leg, even though he practiced last time. Today is just to help build up his confidence that he can put some weight to this side. So his weight bearing is tolerated. So I need you to put your hands here on the crutches. That's your stable point. Okay, got it? And then use your strong side to stand up, which is your right. And you can put your hand in the chair if you like, or if you don't think you need it. Look at that, it's right up. This is great. So Stephen, I want you to now don the crutches, or use the crutches. Well, look at, he's putting a lot of weight on that leg already. He's really ready to go. Maybe not put quite so much weight on your leg. Okay. So, I'm just going to look at your measurements real quick. Look at the crutches out about 6 inches away from your feet. Can you relax your hands entirely and let go of the crutches? And put your hands outside the crutches like this. There. So, stand tall. Oops. Relax your hand. That's pretty close. This is a stowaway process, and it's lining up with the crutch handle. So So we're good to go there. So now put the crutches back on. Good. I'm going to move your chair, because I want to be in a position where I can support. So you notice my foot is outside, his affected side. I have a real wide stance. So crutches go first, and then your weaker leg goes next. Put weight as you can tolerate. Shouldn't be really painful. Does that feel okay? Okay, no increase in pain. Is that correct? Okay, let's do another step. Crutches, this foot, step 2. Okay? Let's go ahead and turn. Let's turn to your stronger side. Turn towards your right. Keep those crutches. The same pattern. Okay? And now go ahead and turn, and we're going to go towards that chair. I put the chair right over here. So go ahead and turn your body. Go this way now. That way. Okay. Yep. So stepping backwards, you go, crutches are going to go back. Then your weak leg, then your strong leg. There. Good. Okay. So Stephen now is going to lose his balance. And he's going to lose his balance forward. Okay. Oops. So I gave him a nice little support here. I grabbed the gait belt. I'm using that supinated grip to do that. And if he was going to fall forward towards the ground, and I was losing control, and he was losing control, I'd have him immediately let go of the crutches. So Stephen, you're going to lose your balance coming towards me, like this. Okay, and I'm giving a little nudge to bring him back up to center. So this time you're going to lose your balance going towards your right. And we're going to a little nudge to come back more towards me. And this time you're going to lose your balance backwards. Okay? Oops, he's losing his balance. Drop those crutches. Oops, yep, keep going down. I wasn't able to release that crutch entirely, but I did the best he could, and I supported his fall. I'm just going to show you one more thing. So let's practice getting back up. Remember, the crutches are where when you get up? They're over on this side, right? Nope, your hands go the other way. Yeah. Like that. Yeah, okay. Got it? Okay, stand up. So, and put the crutches back on the way you had them before. Okay, so if he was losing his balance backwards on the chair, go ahead and lose your balance backwards a little bit. I'm going to bring him back supported to bring him back upright. And then if he was going farther down, I would again have him release those crutches. So I don't want you practicing this at home with your loved ones or family members. We will practice the controlled falling in real time the next opportunity we have to meet when we meet again in person. But certainly the guarding technique that I practice in terms of walking, we'll talk about that, but you should be good to go with the guarding just for practice. And again, for walking, not for controlled fall. All right, so Steve, I'm going to have you have this seat. Remember the crutches go on this side before you sit down. Okay, help a little bit. No, sit in yet. Got it? Okay. Now, do you feel the chair against the back of your leg? Yep. Go ahead and sit down. Bring this foot out a little bit. There. Go ahead and bend and sit. All right. Good job.